Preparations are underway for the assembly of 2 field hospitals here on St. Kitts. A press release from the National Emergency Management Agency, NEMA, said in its mandate to manage disasters nationally, NEMA is in the receipt of 2 field hospitals donated by US Southcoms. The field hospitals are intended to complement the existing health facility by providing care to the growing COVID-19 cases. Accordingly, training of health practitioners and support staff were expected to begin on Monday. The Deputy National Disaster Coordinator, Mrs. Clarissa Langley-Stevens, says the nation is thankful for the timely donation of the field hospitals. The useful gifts from the U.S. government to the Ministry of Health will further strengthen our fight against the COVID-19 pandemic. Mrs. Langley-Stevens urged participants to immerse themselves in the training opportunity that is being provided, as it will make them further equipped as first responders. The donation was made by US Southcoms as part of their ongoing partnership with NEMA and the government of St. Kitts and Nevis. US Southcom is the parent company of TradeWinds. TradeWinds is an exercise that takes place every 2 years with partner nations designed to create partnership with the US government and the Caribbean region. This is an effort to enhance the collective ability of the defense forces and constabularies, as well as to conduct humanitarian assistance and disaster relief operations. Meanwhile, in the Prime Minister's most recent press conference, Chief of Staff at the JNF General Hospital, Dr. Cameron Wilkinson, spoke about how the field hospitals will be utilized.
The field hospital that we are supposed to be getting, it's a 40-bed hospital. And I want you to know, when we say that we're getting a field hospital, it doesn't necessarily mean that this comes with a CT scan and an X-ray machine, etc. And so the best place to have a field hospital is close to the hospital where you have the ancillary services. And so we have been looking at a space between medical ward and private ward. There's a big open space there where we will be in discussions with persons from NEMA and other stakeholders to determine whether or not that would be the best place to put the field hospital. So if someone needs a CT scan, X-ray, etc., they will not have to travel from an off-site to the hospital to get that.
Premier Mark Brantley at his press conference last week said that one of the field hospitals donated by the U.S. would be established on Nevis. Andre Huey, SKN Newsline.